Gentlemen, let's talk about the engine of intimacy, the part of your life that truly keeps the motor running. You've navigated decades of career, family, and perhaps a few prostate checkups. You know your body, but do you truly know hers? As Dr. Vera Sterling, a specialist in urology and an expert in men's health and intimate function, I understand the plumbing, the nerves, and the vascular flow that underpin a satisfying life. But today, we're shifting our focus slightly higher. We're discussing a common blind spot, a delicate area often approached with hesitation: her breasts. Forget the performance anxiety. This isn't about duration or rigidity. This is about precision, connection, and unlocking a profound, often overlooked source of pleasure: a breast orgasm. This is the secret language of touch, a pathway to deeper intimacy that can revolutionize your relationship. The neuro-sensory map of her pleasure. The journey into this realm of intimacy is one of profound physiological understanding, a recognition that the skin, the largest organ, is a complex tapestry woven with sensory nerves. As a specialist, my focus often lies in the pelvic domain, but the principles of neurotransmission, vascular engorgement, and hormonal response are universal across the body. The breast, far from being just a secondary sexual characteristic, is a primary zone of tactile sensitivity, a veritable map of nerve endings just beneath the surface. To approach this area with intention is to understand the anatomical and hormonal symphony it can orchestrate. Our exploration begins not with a rushed, goal-oriented approach, but with the concept of foreplay as neurological mapping. The skin of the breast and the surrounding chest area is densely innervated by branches of the intercostal nerves. These nerves relay signals with astonishing speed directly to the somatosensory cortex in the brain. The quality of this signal, its intensity, duration, and variation, determines the level of arousal and the subsequent hormonal cascade. A gentle touch, a slow exploration, sends a message of safety and attentiveness, initiating the release of oxytocin, the so-called cuddle hormone, which deepens emotional bonding and lowers the threshold for pleasure. This is the physiological bedrock of intimate connection. The first essential tip, viewed through a medical lens, is graduated pressure and temperature variation. The nerve endings in the nipple and areola are highly sensitive to both. Initiating contact with a light, almost feather-like touch, the tinal-like sign of pleasure, prevents overstimulation and allows the central nervous system to acclimate. Think of it as titrating a medication. You start low and go slow. As arousal increases, so too can the pressure, but always with attention to her non-verbal feedback, the subtle changes in breathing, skin flush, or muscle tension. Furthermore, the deliberate use of the mouth, often slightly cooler or warmer than the hand, introduces a change in temperature that activates different sensory receptors, creating a more dynamic and engaging neurological experience. This is pure, controlled sensory input designed to overload the pleasure centers in the most delightful way. We must also consider the vascular component. Arousal is inherently a vascular phenomenon, whether we are discussing penile erection or clitoral engorgement. While the breast tissue itself doesn't engorge like the erectile tissues, the nipple and areola contain smooth muscle and a rich network of small blood vessels. Stimulation causes these smooth muscles to contract and the blood vessels to dilate, resulting in the visible erection of the nipple, a sign of peak sensitivity and responsiveness. Effective stimulation, therefore, is not merely mechanical. It is a catalyst for this neurovascular response. Focusing on the entire architecture of the breast, from the delicate skin near the collarbone down to the curve of the rib cage, and not just the peak of the nipple, maximizes the overall vascular and nerve signaling. The goal is to build a sustained, cumulative response. The second key physiological insight is the concept of referred sensation and crosstalk. The sensory pathways from the breasts share adjacent neurological segments with those from the pelvic region, particularly the genitalia. This phenomenon, which is well documented in neurological literature, means that intense, focused stimulation of the breasts can actually spill over and directly contribute to the building of an orgasm centered in the pelvic floor. When we talk about a breast orgasm, we are often referring to an orgasm that is triggered entirely by mammary stimulation. leveraging this neurological crosstalk to activate the same motor and sensory pathways that result in the classic orgasmic spasm. This requires deep concentration, rhythmic consistency, and a deliberate focus that moves beyond simple kissing or fondling. The third and fourth tips involve rhythm and variation of touch. The human nervous system habituates rapidly to any static stimulus. A touch that is too uniform quickly loses its impact. Think of a metronome, it's monotonous. To sustain and escalate pleasure, the rhythm must be dynamic. This means varying the pace, alternating between dry and wet touch. Saliva acts as a natural lubricant, reducing friction and intensifying sensation, and shifting between broad strokes and pinpointed pressure. The areolar perimeter, the band of tissue surrounding the nipple, is often a zone of high sensitivity that is frequently overlooked. Circular motion applied here, rather than directly on the nipple, can create a powerful, non-habituating stimulus that continuously feeds the pleasure center. The hand becomes a precision instrument capable of minute adjustments in speed and intensity, mirroring the natural ebb and flow of mounting desire. This methodical approach ensures that the erotic signal remains novel and potent, a continuous invitation to the brain to intensify the pleasure cascade. The foundational principle here is attentive reciprocity. While our focus is the mechanism of her pleasure, the efficacy of the stimulation is predicated on the receiver's subjective experience. My counsel as a physician specializing in the mechanics of human intimacy is to abandon the idea of quick tips and instead adopt the ethos of intentional, informed exploration. Her body is not a machine to be tuned, but a complex biofeedback system. The most crucial physiological data you receive is her response, and learning to read that data is the ultimate technique. This careful, deliberate application of neurosensory knowledge is the precursor to the deep, profound, and often whole-body experience known as the breast-centered orgasm. The fifth piece of guidance centers on integration and whole-body connection. Isolated breast stimulation, while pleasurable, often fails to achieve the ultimate goal. The nerve pathways are most receptive when the entire body is engaged. Incorporating a light touch on the inner thighs, a gentle massage of the neck and jawline, or even a slow, rhythmic hip movement helps to generalize the sensation, preparing the muscular and nervous systems for the intense release of orgasm. This is not a distraction. It is a neurological multiplier, increasing the overall body load of pleasure and making the transition to peak excitement smoother and more powerful. We're creating a physiological environment where the final, intense push of breast stimulation can successfully trigger the total body response. The stage is set for a deeper, more profound escalation, one that requires a shift in focus to the final, rhythmic push to bring this sensory journey to its intense, explosive climax. The erotic climax and sustained connection. The first part of our script established the neuro-sensory foundations, the principles of graduated pressure, temperature variation, and the critical concept of neurological crosstalk between the mammary and pelvic nerve segments. We now transition from mapping the territory to accelerating the engine toward the desired peak response. The pursuit of a breast-centered orgasm is an exercise in sustained, focused sensory input, requiring both rhythmic endurance and the final application of intense, non-habituating stimulus. The sixth essential insight focuses on rhythmic consistency and non-stop momentum during the pre-climax phase. As arousal nears its peak, the nervous system requires a steady, unwavering signal to maintain the heightened state. The touch must become more insistent, a repetitive, focused application of pressure that avoids any abrupt breaks in contact. The shift here is from slow, gentle exploration to a deliberate, high-intensity focus on the most responsive areas, typically the nipple and areolar complex. The use of a circular motion, combined with a slight pulling or suction, using the mouth, simultaneously stretches the sensory nerve endings and maintains peak vascular engorgement. This specific high-frequency stimulus leverages the principles of temporal summation, where rapidly repeated signals, which individually might be sub-threshold, cumulatively reach a point that triggers the intense neural discharge of orgasm. The hands and mouth must work in concert, a relentless yet sensitive duality of sensation. The seventh tip, crucial for the final ascent, is the strategic use of simultaneous, counterintuitive pressure. While the focus is on the breasts, introducing a light, steady pressure to a non-erogenous zone, such as the inner elbow or the small of her back, just as the breast stimulation reaches its zenith, can often serve as the final neurological trigger. This may seem counterintuitive, but the brain, when overloaded with a primary intense pleasure signal, sometimes requires a sudden, secondary, and different sensory input to fully lose control. This is akin to the Valsalva maneuver, and where a shift in intrathoracic pressure can affect heart rhythm. Here, a shift in sensory input can push the pleasure response over the threshold. This technique must be applied judiciously, with an immediate return to the high-intensity breast focus, but it is a powerful tool for achieving the breakthrough required for a full-body, breast-triggered release. The neuroendocrine surge during orgasm is a remarkable event. From a medical perspective, it involves a massive release of prolactin, endorphins, and the continued flow of oxytocin. This hormonal cocktail is responsible for the feeling of intense pleasure, euphoria, and deep relaxation. Therefore, the eighth piece of guidance concerns the post-orgasmic phase, the refractory period of intimacy. Unlike the male refractory period, which is primarily a detumescence and recovery of erectile function, the female post-orgasmic experience is an opportunity for continued, non-goal-oriented intimacy. The breasts remain highly sensitive immediately following orgasm. Maintaining a gentle, loving touch, slow caresses, soft kisses on the chest, ensures that the oxytocin and endorphin levels remain high. This is the period of deepest emotional imprinting and bonding. Cutting off contact immediately post-climax diminishes the profound psychological and physiological benefits of the hormonal release. Sustained, gentle touch here is as medically and intimately vital as the stimulation that preceded it. Finally, the ninth and most encompassing tip, one that underpins all others, is the need for vocal and nonverbal communication and validation. While this script focuses on narration and action, the internal thought process of the provider, in this case the partner, must be rooted in empathy. As a medical professional, I analyze systems. In intimacy, one must analyze and respond to subjective experience. The partner must be present, attentive, and willing to receive and process continuous feedback. This means adjusting pressure based on a sharp intake of breath, slowing down when the eyes close in intense focus, and escalating when the breathing becomes shallow and quick. Consent is continuous, and so is sensual feedback. The most effective breast stimulation is not a rigid application of techniques, but a fluid, responsive dance built on trust and acute observation. To truly drive her wild is to prioritize her subjective feeling over a mechanical outcome. In conclusion, the path to unlocking this profound source of ecstasy is a sophisticated application of physiological principles. It is about graduated stimulus, rhythmic focus, harnessing neurological crosstalk, and understanding the hormonal reward system. It is a journey that elevates the act of touching from a casual gesture to a deliberate, informed, and deeply connecting act of intimate expertise. As Dr. Vera Sterling, I assure you that this attention to detail is the prescription for a richer, more satisfying, and more emotionally connected intimate life. The mastery of this technique is not just about pleasure, it is about profound, sustained connection. And now, for the final diagnosis, gentlemen. The shocking truth is that the pursuit of the breast orgasm is, medically and psychologically, an unconscious test of your emotional maturity. She is testing your capacity for tenderness, patience, and non-performance-based connection. If you rush it, the entire physiological cascade collapses. The most powerful sex organ you possess isn't the one you're worried about keeping rigid. It is your attentive, non-judgmental brain and your capable, deliberate hands. The nerve pathways that carry pleasure are the same ones that carry safety. When you unlock this climax, you are giving her an experience of absolute, unconditional security. Stop chasing performance and start building trust. That is the ultimate prescription.